Providing integrated community care is one of the biggest challenges facing the NHS. We visited Fleetwood in Lancashire with one of the NHS Alliance's new leaders, Mark Spencer. Now, Mark believes that community can be at the centre of patient care, but only with the right staff, the right teams and the right infrastructure.
Dr Mark Spencer has been a GP in Fleetwood for 25 years. Fishing used to be the town's lifeblood, but it's long since gone. Now jobs are hard to find and there's widespread deprivation.
And unfortunately, this is the place that people tend to gravitate to, who are unemployed, job prospects with drug, alcohol and mental health issues as well. You're going to die 10 or 15 years earlier if you're a resident here. Within the practice, on average, we'll pick up at least 2 life-threatening cancers every week.
It's against this backdrop of significant need that Mark is bringing care much closer to home. This isn't just a GP practice, it's a primary care hub, providing 7-day access to a wide range of services in a building he helped to design.
All of the services with a heavy footfall are downstairs, such as GP practice and same-day centre. But upstairs we have services that require something a little bit quieter. Here we have a primary care mental health service, particularly looking at conditions such as anxiety and depression.
It's quite innovative. He's open to new ideas and trying to keep the practice ahead of the game. Well, we now have the ability to renew prescriptions online, even video conferences with the GP.
Mark is probably one of the most dedicated GPs to changing facilities and services for patients that I've ever come across. Completely dedicated in this respect and probably one of the best I've known to do it as well.
So through here, this is our call centre.
FCMS is the out-of-hours GP cooperative Mark co-founded and has now diversified. It runs the call centre for the Silverline charity Esther Ranson set up to help the elderly and was one of the original pilot sites for the 111 call service, which it now provides across the Northwest in partnership with the ambulance service. But Mark didn't just want to win the contract. He saw an opportunity to improve the NHS by channeling more patients through primary care.
Best use of the scarce resources that we have. There is pressure in A&E departments, undoubtedly there is, but a number of patients can be seen very safely in primary care.
But changing mindsets can be difficult, so patients who still head straight to A&E will also be assessed by a primary care team.
We're entering what used to be the main door into the A&E departments at Blackpool Victoria Hospital. But it's now been redesigned to be a primary care facility.
Instead of a triage nurse having to assess every patient, receptionists use the same 111 call handling software to stream patients, diverting those they can to the on-site primary care centre.
27% are being streamed safely into a primary care setting, which is having a significant impact on how busy A&E in general is, which benefits everybody.
It's an approach Mark believes could be rolled out across the country, but his ambitions don't stop there. He's brought me back to an empty room above his GP surgery, which is about to be transformed into a 20-bed inpatient unit.
Nurse-led, but with direct GP support and primary care support, I think we can safely manage people within their own community and return them home.
It's a vision for primary care Mark is convinced can work, delivering more services in the community, cost-effectively and closer to home.